Hello, everyone, and welcome to the Aging Initiative P2R Pilot to R Award informational webinar. This webinar is coordinated by the Aging Initiative, which is an NIA-funded infrastructure project that builds the expertise and leadership of two powerhouses for research on multiple chronic conditions. These are the Healthcare Systems Research Network and the Claude D. Pepper Older Americans Independent Centers, or Pepper Centers. The Aging Initiative is led by Dr. Jerry Gerwitz at University of Massachusetts and Myers Primary Care Institute, along with co-PIs Dr. Jay Magaziner and myself. Before we get started, I need to cover a few technical details. Due to the number of registrants for today's webinar, we have placed the phone lines on mute to reduce audio feedback. Unless you are logged in as a host or panelist, your line will be muted. However, we welcome and encourage audience participation using the Q&A or chat features on the webinar software. If you are in your Cisco webinar portal, look at the row of circles across the bottom center of the screen. Click on the chat bubble icon until it is highlighted blue. If you have questions for our speakers, please click on the Q&A tab to the right side of your screen and type in the Q&A box. We will keep an eye out for those questions under the Q&A icon. As time permits, we will read questions for our speakers after the presentation. If you have technical or logistical questions, however, we ask that you submit those using the chat box that is above the Q&A box. Please make sure that you are identified either by name or by participant ID so our webinar hosts will be able to troubleshoot any problem you're having with the audio or other issues. With the chat function, you can choose whether you'd like your comment to be visible to all participants, or you can choose to send the question only to the hosts. We extend a huge thanks to Catherine Anzoni and Chris DeLude from the Myers Primary Care Institute, who do amazing work behind the scenes to make these webinars possible. They will be monitoring the chat functions today to help with technical troubleshooting. Next slide, please. I would now like to introduce the P2R Award co-leads of the Aging Initiative, myself and Dr. Elizabeth Bayless. My name is Elise Adams. I am Associate Director for Healthcare Delivery and Policy at the Division of Research at Kaiser Permanente, Northern California. Dr. Elizabeth Bayless is a Senior Investigator at the Institute for Health Research at Kaiser Permanente, Colorado, as well as a Professor of Family Medicine at the University of Colorado School of Medicine. Next slide, please. So first, we want to talk a little bit about what these P2R awards are. These P2R awards are one-year pilot projects focused on multiple chronic conditions that support activities that will increase the likelihood of successful funding of an R01 or comparable application. Up to 4 grants not exceeding $40,000 will be awarded. However, we welcome all types of research projects as long as there is a focus on patients with multiple chronic conditions, and the findings will lay the groundwork for an R01 type research application. Specific examples of research topics are available in the following article that's on your screen that was published by Dr. Bayless and others as part of the Aging Initiative. Next slide, please. There are a few application requirements that I'd like to go over. The first is that the principal investigator on the application must be affiliated with either an HCSRN Research Center or a Pepper Center, or be a current or former Aging Initiative MCCs scholar. Applicants must include collaborating investigators from both an HCSRN Research Center and an OAIC. The application must involve at least one early career investigator on the team. These may also be and are encouraged to be principal investigators. An early-stage investigator is defined as not having received a major grant from NIH, AHRQ, or PCORI, effectively an R01 award or equivalent. And I want to pause here just to say that those people who already have K awards, career development awards, from NIH, AHRQ, or others, are eligible to apply either as co-investigator or as principal investigator. Further, all applications will require IRB approval at the appropriate institution, and those approvals will be required before the funds can be released to the institution. Next slide, please. There are a number of submission requirements, which you can see on the screen and, of course, are in the materials that have likely been emailed to you. But they include sort of the standard face page and abstract, specific aims as well, which is 1 page. The research plan can be up to 6 pages. However, it is not required to be 6 pages. So just to be clear, it is not, you don't have to write 6 pages, but the limit is going to be 6 pages on that research plan. And it should describe how the pilot will work and how it will support the planned R1 type application. Human subject section is also required if applicable, as well as biosketches in the NIH format. The budget is for 1 year and is not to exceed a total cost of $40,000. That includes indirects. The budget justification templates can be found on the application form or on our website, as well as the F&A indirect cost checklist. Next slide, please. In addition to the standard NIH criteria for review, we will also consider the study's relevance to older adults with MCCs, whether or not the study is leveraging OAIC-related data and or resources and or the unique features of the HCSRN and its data. Furthermore, the likelihood that the proposed study will be completed within 1 year is very important for this application, as it is a pilot application and we want to see the studies move forward in a timely way. And further, the likelihood that the project will lead to submission of a fundable grant proposal by the end of the 12-month period will also be part of the review criteria. All applications will be assigned to 2 reviewers affiliated with the Aging Initiative. Next slide, please. In addition to the standard, in terms of key dates, the full applications are due June 16th, 2019. So I know June seems like a ways away, but it really isn't. And so we're hoping that if you're interested, you'll get started soon, and we'd like to see your applications on June 16th. We will announce who is receiving the awards on September 1st of this year, and the earliest possible start date will be November 1st, again, pending IRB approvals. The online application can be found at the URL that's left here, as well as the one that is included in the application materials that were sent around via email and on our website. Again, more details can be found on the website, and any inquiries can be sent to Christopher DeLude at Myers Primary Care Institute. Sorry, Elizabeth. Sorry, Liz. I think you're up.
So, hi everybody, and Elise and I would welcome any questions or, I guess, delivered via chat or any other means to make sure people have their questions answered about the program or about any specifics related to individual project ideas. Catherine, are you or Chris receiving any questions that are sort of bubbling up from the group?
I don't see any questions yet, but I will say it is a fairly small group today as well, so if someone feels more comfortable asking their question out loud and wants to just request to be unmuted to ask the question, I'm happy to do that as well.
Yeah, why don't you unmute the group since it's really not that big. It looks like the list has 17 according to my screen. And so if folks want to just speak up and ask questions, I'd say go for it. Elise and Elise, I'll speak for you. I want to be careful not to volunteer your time too much, but I realize that this is sort of an initial, it could be for many people, an initial informational opportunity. And as people sort of sit down and think about whether they want to apply for some of the funding, questions may come up, and you're welcome to contact us or contact Catherine, and she can track us down one of those possibilities, so that we can help folks decide if their idea is a good fit or whatever.
I have a question. Can you hear me?
Yep, go ahead.
This is Jonathan Weiner from Kaiser, Northern California. I was wondering if you could talk just a little bit more about the multiple chronic condition requirement and what you mean by that more specifically. Sort of, any chronic condition, medical disease, cancer, dementia, or are there certain conditions that you're more interested in?
Elise, do you want to take that, or do you want me to try?
Sure. So thanks so much, Liz. And so hi, Jonathan. That's a great question. So really our only requirement is that the person have multiple, or the population have multiple chronic conditions. So i.e. more than one chronic condition, like diabetes, dementia, depression, et cetera. We're not picky about the specific condition, though I will say that because we want people to be working toward an R01, you should have your ideas about, sort of who might fund an R01 for that particular patient population. So keep those things in mind, just in terms of the fundability of the future R01. But we have no stipulations about specific chronic conditions. It's really up to the individual investigators.
And I would just add that there's sort of two ways of conceptualizing multiple conditions. One is to conceptualize it in terms of an index condition plus one or more other conditions, which is sort of this comorbidity model, and then the other way of conceptualizing it is more of a multi-morbidity model where there's no index condition and the population simply has some level of disease burden. I don't know if that is relevant for thinking about topics, but I think either of those ways is fair game.
No, that's very helpful. Thanks very much.
Hi, I have a question. My name is Tony Chow. I'm calling from UTMB in Galveston, Texas. Can you guys hear me?
Yes, go ahead.
Okay, yeah. So I was curious about what some of the research areas that you were kind of looking for. So let's say in my case, I'm interested in older adults with obesity, osteoarthritis, and diabetes. But are you looking for more research related to clinical trials, or could it be like very basic science also, like looking at some molecular pathways in skeletal muscles that are affected by these multiple conditions?
I would make a guess that and Elise, you can correct me, that the criteria of having something, whatever it is, lead to an R01 is or be potentially promising pilot work towards an R01 is a primary consideration. And the other is to be able to have the project benefit from the collaboration between HCSRN investigator, one or more Pepper Center investigators. And so if the more basic science stuff really can lend itself to that collaboration, then that's great. But from the HCSRN experience perspective, it tends to lean more towards health services type questions because that's what the collaborations tend to support mostly. That's off the top of my head. Elise, do you want to add anything to that?
No, I would completely agree. I think that's a perfect assessment. There's no hard rules about what it needs to be other than what we've already described. However, I would just sort of echo what Liz said, is the idea is to take advantage of the HCSRN and OAIC infrastructure. And so generally speaking, those projects that focus on things like health services research, even building towards clinical trials that have an impact on care delivery, are going to be most likely to be well aligned with those two sort of bodies of or institutions of networks rather than the bench science. But again, it depends on sort of where you sit and sort of whether you're at a Pepper Center that has that particular strength.
Okay, thank you.
Hi, this is Xiaozhuan from Harvard Pilgrim Healthcare Institute. Can you hear me there?
Yes, go ahead.
I have a couple of questions. The first question is related to the data required for the grant. I think if I remember correctly from earlier slides, we need to propose a project that will utilize the OAIC-related data infrastructure. I was wondering if we are restricted to use that data, or we can use other data that we have in-house as well.
I don't think there are any restrictions on the data that are used, only, again, to emphasize the value of having the different partnerships of people. but I wouldn't necessarily imagine that the data had to come from one particular place.
Okay, that's good to know. If and also the funding for the, I think the 40,000 K, would that cover the data access if we propose to utilize the infrastructure and the data from the HCSRN?
Oh, Elise, I'm thinking, help me because you were more involved in the budget development, but I'm thinking that the money would need to cover any necessary data specialist or programmer time within the sites. I don't think that that's available without support.
That's correct. That's correct. Was that the question? Was it about how to extract the data, or or if there are data fees? I'm not sure what the nature of the question was. Yeah,
if there will be data fees associated with accessing those data from HCSRN.
Yeah, so you're part of the network anyway, and part of the VDW, so there shouldn't be any issues, I would think, with respect to data fees. We generally don't charge those, but again, without knowing a little bit more about the specific data you're thinking about, it's hard to give you a definitive answer. But I think Liz's response is spot on, that it would need to cover the cost of extracting the data, but there shouldn't be data fees applying.
Okay. Can I ask one more question? There, in the paper that I referenced, that has all these different research priorities, and they are also ranked. So I was wondering, would the proposals be also reviewed or scored by kind of the ranking of our proposed objective? How that is aligned with the ranking in that paper? Because different priorities may be ranked higher in that paper. I just wonder if that will play any role in the selection criteria of the awards.
I don't think a topic that's from that priority list is required, and in that case, then the ranking would not be necessarily a strong review criterion. However, having said that, that paper came from some work that Myra Tismanetsky did to really do a fairly broad survey to understand which topics were of particular interest to a broad range of stakeholders in both organizations. And so I think the guidance provided by it is somewhat useful. I thought I saw Jerry's name too. Jerry, if you feel differently about that, or Elise, please speak up. That was sort of off the top of my head.
Hi, it's Lisa. I'm not sure Jerry's on, but I completely agree. The list of the paper is really to give you an idea of the types of things that the Aging Network has identified in the past, the initiative, and so I think it helps to sort of orient you to where some of the things that we discussed previously. But there's certainly no requirement that it has to be one of those topics, and therefore I don't foresee us including that in any kind of review criteria. It really is more to help the applicants understand sort of the things that the Aging Initiative has been focused on the last several years.
Okay, great. Thank you.
It looks like we also have a question in the Q&A box. It says, what does the affiliated with HCSRN-OAIC mean? The PI needs to be working in these institutions? And the answer is yes. So the Aging Initiative is a partnership between these two groups, the HCSRN and the Pepper Centers. And for that reason, the PI needs to be affiliated with either of those groups. And it really is the best way for the investigators to have access to the resources, not only data, but people, resources in each of these networks. And so that's one of the big reasons. Liz, I don't know if you want to add anything to that response regarding the institutional affiliation.
No, I think that captures it.
No.
Any other questions from anybody? Well, I would say if none come up in the next couple of minutes, feel free to track one of us down with additional questions as you start to think about project ideas. Catherine, do you have anything that you would like to add to the information here or to the process? Because we could end up wrapping up somewhat early.
To kind of think of, what would be useful. And I mean, if anyone's familiar with the pilot projects program that we did through the previous iteration of the Aging Initiative, there are a lot of things about this program that are similar, though we did try to expand upon that a little bit and make some other changes, so it is a new program. But if folks need help connecting with others in the different networks, we try to be helpful with that as much as we can, and we're happy to try, though sometimes it can be difficult because the networks are large and we don't know everyone in them, but we do try to foster those connections however we can.
Elise, do you want to add anything else, or do you think we're ready to wrap up?
No, just I guess that we will have a presence at the upcoming HCSRN and Pepper Center annual meetings in April, so that's another opportunity to connect with us. But just thanks to everyone for your interest, and I hope you will consider applying.
I'd say the value of these is partly the small grant and probably mostly the chance to get to know new people and work together. Great. Well, don't hesitate to call either Elise or myself, and we'd be happy to talk to you. And thank you, Catherine and Chris, for getting everything ready.
Yes, thanks so much.